Hello, I'm here to talk about dental caries and plaque management. Dental caries or cavities happen when bacteria in the mouth mix with sugars from foods and drinks. The bacteria produces acids which slowly wear down the outer layer of your teeth called enamel. If this continues, the damage can reach the softer layer inside the tooth, causing sensitivity, pain, or bigger problems. Plaque, the sticky film that forms on your teeth, is where these bacteria live, so it's the starting point of cavities. To prevent cavities, it's important to remove plaque daily. Brush your teeth twice a day with fluoridated toothpaste. Make sure to reach all surfaces. Floss once a day to clean between teeth where your teeth can't reach. Limiting sugary snacks and drinks also help, and regular dental checkups make sure any problems are caught early. Following these steps keep your teeth strong and healthy. Hi Katie, so today I'm going to show you what's going on with your gums and teeth. Right now you have some gingivitis. The bacteria and plaque is irritating the gums, making them red, tender, swollen, and likely to bleed when flossing. If plaque is not removed, it can harden into calculus. With proper flossing and brushing and professional cleanings, it is still reversible. To reverse that, I'm going to show you some techniques on ways to floss. So we want to use the Bass technique. We want to angle your toothbrush at a 45-degree angle and get into the massaging the gums. If there is any recession, you want to do the modified Bass where you roll. Flossing is really important because it helps get under the gums and in between the teeth. When you go in between the teeth, you want to grab your floss, wrap it around your middle fingers, and use your pointer finger and thumb to guide it in between the teeth. When you go in between the teeth, do a C-shaped motion, wrapping your floss around the tooth on both sides. If getting behind to your molars is hard, we have a flossing tool. You want to wrap your floss around this little button and then guide it up towards these little notches and back down where you wrap it on your something like this. We have cheeks on this side, so this helps get right in there into the gums, helping get that 33% of plaque that you would miss normally without brushing. If you only brush and not floss, you miss that 33%. Hi Katie, so last time I talked to you about the gingivitis that you had, but now it has progressed into periodontitis. And so what's happening now is that your calculus and plaque has built up against the gum line and is breaking down the connection between the supporting soft tissue and the teeth. And as the disease progresses, bacteria will begin to attack that bone as well. So I have here, you can see. To clean that out, our hygienist will need to go in and do what's called a deep cleaning or scaling and root planing. That means that they'll gently go under the gums and remove that hardened buildup and smooth the root so that the gums can attach and heal once they remove. If we don't remove that buildup and change how we take care of our mouth, the infection can get worse and lead to bone loss, which the bone is holding our tooth. So then we lose our teeth. If this continues, your teeth can start to loosen and even fall out. So our goal now is to stop the infection and keep our teeth strong. If you have, or you can get a water pick, it would look something like this. There's different kinds. There's one where it's like a battery. This will help because it can reach areas that brushing and flossing sometimes they miss. Especially along the gum lines between the teeth. When you brush, I want you to brush using the Bass technique, which we talked about last time, where you angle your toothbrush at a 45-degree angle and do small circles against that gum line. If you place your toothbrush at a 45-degree angle towards the gum line, make gentle small circle movements right where the tooth meets the gums and move around the whole mouth. This will help clean underneath the gums where the bacteria like to hide. If you have gum recession, you'll do that modified Bass we talked about last time, where you roll at the end of your small circles and roll. If you have bridges or brackets, we'll use special tools like the Super Floss, which has a little spongy area. And then we have floss threaders to get underneath the wires and go around those crowns. Also have some open spaces between your teeth, so interdental brushes, these little Christmas tree shaped brushes, work great to clean in between your teeth. So what you do is just go in there like that. And here are another version you would find in your local store, and these ones are just a rubber tipped. Because your gums are a little inflamed, I want you to help bring blood flow and heal by gently massaging them with a perio aid, a toothpick. What you're gonna do is slide it in through this hole here, tighten it, and then we can break off the excess. As the toothpick goes into the embrasures here, the space, I want you to massage to bring that blood flow. And as you do it along the teeth, it's gonna soften up, so it's gonna just massage. So to keep things healthy after your deep cleaning, here's what I want you to do. Brush twice a day using the Bass or modified Bass technique. Floss once a day, or use the Super Floss, interdental brushes if needed. Massage the gums daily with our perio aid toothpick. Come in for your regular cleanings and checkups. We need to keep up with these habits so your gums can heal and stay healthy. You'll start to notice less bleeding and less inflammation soon. So there's 4 brushing techniques. The first one is the Fonz, mostly for young children. It's easy, gentle, and it covers all surfaces. You want to have your mouth closed, and you grab your brush and gently do circular motions covering the entire tooth, sweeping against the gum line. The second brushing technique is the Bass technique. This is best for removing plaque at the gum line and preventing gum disease. It's standard recommended for most adults. So you're going to have your brush at a 45-degree angle towards the gum line, gently vibrating or wiggling the brush back and forth. The modified Bass is when you do that same 45-degree angle, wiggling and swiping away from the gum line. The third brushing technique is called the Stillman's technique. It's good for massaging of the gums and slight exposed roots. It helps stimulate circulation. So you're going to hold your toothbrush at a 45-degree angle, partly on the gums and partly on the tooth, with short vibrating strokes. Lift the brush off the gums after each stroke. There you go. The modified Stillman's is when you roll after that. The vibration on that area. The fourth brushing technique is the Charters technique. This is ideal for orthodontic patients. You want to hold your toothbrush at a 45-degree angle, but unlike the Charters or the Stillman's, you're going to want to face it down. Doing small vibration strokes, pushing debris away from the gum line. For these patients, we also want to brush down here at a 45-degree angle. I'm going to be going over some preventive instructions prescribed by the dentist. For an amalgam filling, avoid chewing on that treated side for at least 24 hours to allow the filling to fully harden. Be careful until the anesthetic wears off to prevent biting your cheek, tongue, or lips. It is normal to experience mild temperature or pressure sensitivity for a few days. You may take ibuprofen or Tylenol as directed for any discomfort. If your bite feels uneven or if pain lasts more than a few days, contact our office for any adjustments. Maintain regular brushing and flossing, but do so gently around that filled area. Avoid eating any hard or sticky foods for that 24 hours. For a sedative filling is placed to soothe the tooth and allow healing. Avoid eating until the numbness wears off. Not chew hard or sticky foods on that side of the mouth. Mild sensitivity is normal. You may use over-the-counter pain medication as needed. If the filling comes out or breaks, call the office immediately. It must be replaced to protect the tooth. Brush gently around the tooth and continue normal oral hygiene. For a provisional crown or a temporary crown, avoid chewing hard or sticky foods that could dislodge the temporary crown. Avoid eating on that side for 12 hours. If the temporary crown comes off, gently clean it. Apply a small amount of Vaseline or toothpaste inside and place it back on the tooth until you come in. Brush normally, but floss carefully by sliding the floss out to the side rather than pulling it up to avoid loosening the crown. Some sensitivity to temperature or pressure is normal until the permanent crown is placed. Contact our office if the crown breaks, falls off, or causes pain. For composite filling, your lips, cheek, and tongue may feel numb for several hours after treatment. Avoid chewing until the numbness completely wears off. Sensitivity to hot, cold, or pressure is normal for several days and should gradually decrease. You may take over-the-counter pain relievers if needed for tenderness. Avoid chewing on the treated side until the numbness is gone or the filling has fully set. If your bite feels high or uncomfortable, call our office to have it adjusted. Continue normal oral hygiene, brush and floss gently. For a permanent crown, do not eat or drink for 30 minutes after the crown is cemented. Avoid hard, sticky, or chewy foods for 24 hours until the cement sets. Slight tenderness or mild sensitivity is normal for a few days and will subside. Brush twice daily at a 45-degree angle and floss. Careful around the crown to prevent decay or gum irritation. If the bite feels uneven or discomfort proceeds beyond a few days, contact our office.